Is your acute gout flare an emergency? Have you ever wondered if an acute gout flare is something to rush to the emergency room for? While gout flares can be extremely painful, they are not usually classified as medical emergencies. Most acute gout attacks can be managed effectively with medications like non-steroidal anti-inflammatory drugs, colchicine, or corticosteroids. Starting these treatments within 24 hours of the onset of symptoms can significantly reduce pain and inflammation. Typically, these flares resolve within 1 to 2 weeks with the right therapy and do not pose an immediate life-threatening risk. However, there are specific situations where an acute gout flare may require urgent medical attention. If you experience severe pain that cannot be controlled with your prescribed medications, it is essential to seek help. Additionally, if you notice signs of a joint infection, such as fever, chills, redness, warmth, and severe swelling, you should get evaluated right away. These symptoms can mimic gout but requiring different treatment. Another reason to seek emergency care is if you cannot tolerate oral medications due to gastrointestinal issues or other health problems. If multiple joints are involved and you have systemic symptoms, that is also a cause for concern. Moreover, if you have underlying medical conditions like kidney failure or are immunosuppressed, managing gout can be more complicated, and you should consult a healthcare professional. For most typical gout flares, first-line treatments include non-steroidal anti-inflammatory drugs like ibuprofen or indomethacin, colchicine at appropriate doses, or corticosteroids if the other options are not suitable. Non-drug measures can also provide relief. Resting the affected joint and applying ice can help ease the pain. It is crucial not to start urate-lowering therapy during an acute flare unless it has already been prescribed, as this can worsen your symptoms. Always consult your healthcare provider for personalized advice, especially if you experience recurrent flares, severe symptoms, or have other health conditions. While acute gout flares can be distressing, they typically do not require emergency care unless accompanied by signs of infection or severe systemic illness. In summary, while an acute gout flare is generally not an emergency, timely treatment is essential to control symptoms and prevent complications. If you notice signs of infection, uncontrolled pain, or other serious health issues, do not hesitate to seek emergency care.